Morning, everyone. Dr. Eric, the fitness physician. Just a quick Q&A from a client and a couple colleagues. This has come up in the past before, so oftentimes when we're talking about hormone therapy, question, especially with my men, is that when they're on testosterone therapy, they develop acne. What can I do about this? Why is this happening? So, there's a long answer to it, but obviously in acne, it has to do with a lot of different things. It's the natural bacteria, it's oil buildup, it's hormones, it can be a lot of other things too, of course. So it's a bigger answer, but bottom line is, I always want to dig into the basic stuff: nutrition, stress, exercise, what are they taking, etc. So think about when we were, teenagers. We obviously had a lot of hormones, we had a lot of oil, or probably weren't eating the best, and we had a lot of acne. So when guys are on TRT or testosterone therapy, obviously we're getting those hormones back up to where they were, not quite as 18, but getting them better. So that can, of course, induce an environment, especially if you have oily skin or poor nutrition, etc., that it can kind of resurge and have that reappearance of acne. Women get acne too, although it's usually more other things as well, different varying estrogen levels, a lot of other things involved there. So we'll talk about that in another video. But with guys, obviously the first step is, number one, how's your stress? How's your diet? Clean up your nutrition, lower the stress. Cortisol, of course, can do a lot of things, and it's to the body and certainly to the skin as well. It can precipitate acne as well as other things. So we want to manage stress. We want to clean up the diet and get rid of the bad foods, eat whole foods, etc. But again, if it's hormonally related, that you were fine before, now you're on TRT, now you're getting it. Now what do I do? That's a common scenario. Sometimes it takes just an adjustment period, and your body will just adapt and overcome it. Other times you may need to temporarily lower the dose and then slowly ramp it up. A lot of guys are on too high of a dose, or they go too high too fast, and it's just too quick. Most of the time, you don't need that high of a dose. We can do pretty moderate doses to have awesome results, and then you don't get those side effects. Same thing with things like Arimidex and things. You don't need that if you're dosing it properly. So that's, again, a whole discussion for another day, but if you're dosing it properly, it shouldn't be an issue. But temporarily, you may need to lower the dose. Some other things that can mean, of course, local hygiene, good cleansing, a good facial or body cleanser. You can use a lot of topical products such as benzoyl peroxide, salicylic acid, etc. The nice topical retinol creams, etc., all are very, very good for getting rid of, and that might be all you need. Nutrition-wise, of course, we touched on a little bit, but of course, things like zinc are very good. It helps body with skin turnover, helps the skin cells that they die at the appropriate time, the apoptosis. So appropriate doses of zinc are helpful as well, 30 to 50 milligrams a day. Vitamin B, pantothenic acid, or B5, is a good one to take as well. Has to do a lot with fatty acid metabolism inside the skin, the body. When the propionibacterium sit on the skin, and then there's a lot of oil, there's an interaction. Of course, when you get a lot of bacteria, a lot of oil buildup, and you get some thickened skin, that's the recipe for acne. So by eliminating that, by improving the fatty acid metabolism, burning up those oils don't accumulate, that can be beneficial. So pantothenic acid, carnitine can also help with the metabolism of fatty acids as well. Has a lot of benefits internally. I have it in my Omega-3 supplement, actually, more for fat loss, but which it can help. It certainly can help with the skin as well. So those are a couple of really quick, simple things. Of course, some people will talk about the anti-inflammatory effect of the above molecules, fish oils, things like that. Curcumin. These are all good anti-inflammatory. Anything that's going to be an anti-inflammatory effect can be very beneficial as well. Of course, if all those things don't work and you're doing aggressive you can go to topical antibiotics, topical erythromycin, things of this nature. If you really have to, people that have real severe acne, they may need a short course of oral antibiotics like doxycycline or minocycline, or even erythromycin, but typically the first two work pretty well too. Accutane is kind of the far end of the spectrum. It's an oral medication, but it has a lot of potential side effects, so it's something you want to reserve for severe cases only. So those are some simple things, but again, one thing I'd be remiss in mentioning, we talked about the hormonal environment. Guys ask, is it because my estrogen's high? What can I do about that? Most of the time, it's not estrogen. That's more with women. It's more because of the testosterone itself and because of its metabolite, DHT. Testosterone is metabolized into DHT, and that has a very pronounced effect, which has a lot of beneficial effects on the body. Actually, a lot of studies have shown that that's responsible for a lot of the beneficial effects in terms of strength and libido, etc. But DHT also can stimulate a lot of oil and a lot of acne if in some men. And again, some of it's genetic, but some of it's lifestyle too. So it has to do more with the DHT than the estrogen. Some guys, have tried anti-estrogen therapies and things like this, but again, it's usually not the case. All the above strategies I mentioned are going to be much more beneficial. And again, most guys do well on those types of regimens. So that's kind of the why, the what, and wherefore. So I thought it was a good question. I know it comes up often, so I figured I'd address that. Everyone reach out to me with any other questions related to hormones, peptides, fitness, nutrition, etc. Happy to answer. So everyone have a great day, and we will talk to you soon. Bye.